Hello, this is Dr. Gay from First Look MRI, and this is a 50-year-old female with complaints of back pain, also stiffness in the back. And as we look at this side view, we note that this is what we call a T2 weighted view. There's fluid in the spinal canal that's really light bulb bright. We see some nerves coming down here through the spinal canal, and they come out through these holes called the foramina along the edges. The foramina look good. The spinal canal is wide open. The spinal cord up here looks great. So far so good. Each one of these vertebral bodies looks nice and square. These are the hard bones, and the discs, the cushions in between, are all looking pretty good on this view. Some of them are a little bit dark, which we call disc desiccation, but it doesn't look like there's any disc herniation, and really no bad arthritis that we can see on this view. Now, fat is fairly bright. There's fat in the back here, and the fluid is even brighter on this. And in this region, things look pretty good. These look like sharply defined vertebral bodies. There's no significant abnormality, but as we'll see, if you have edema, it may blend with the marrow and just you really can't see the bony changes. So we're going to look at another view. You wonder why MRI has so many different views, because sometimes pathology may be invisible on one view but show up well on another view. And this is an example of that. So there's no disc herniation, but over in this region we'll see there is some abnormality. On this view, this is called a stir view, and the stir has fat dark, so the fatty marrow is dark, subcutaneous fat is dark, but edema or fluid will stand out as bright. So there's a little bit of edema, and it stands out as bright on the background of dark marrow. So we see that the patient does have trouble here in the front. There's a little haze of brightness here, a little bit of marrow edema, a little subtle brightness here, marrow edema. So the anterior vertebral body margins of L3 and L4 have some subtle brightness. And also there's a white line here. This is the annulus fibrosus. It holds all the disc material in. The annulus covers the disc here and holds the stuff in. And this has an annular fissure or annular inflammation here that's causing it to be abnormally bright. And it goes down here, and you can see some subtle cortical changes of the anterior vertebral body margin. So we call this an enthesopathic erosion or enthesopathic changes, and that's where ligaments attached to bone, they can become inflamed and cause bony changes and marrow edema. So we do have like an enthesopathic process here. This is the anterior longitudinal ligament coming down in front of that black line, and this is underneath that. And now we're going to look at another view. So we have some marrow edema, subtle cortical erosions, inflammation of the annulus fibrosus here anteriorly, and some erosion. So an enthesopathy or spondyloarthropathy. And we see this, we think about a couple things. Number one, in the spine, we think about ankylosing spondylitis. And that can cause multi-level straightening of the anterior vertebral body margins. They have inflammatory changes along the anterior margins, and they cause the vertebral bodies to become squared off. Looks like a bamboo. This is a little unusual that it's just down here and just affecting this one. But now we're going to put up another view here, because we don't see it at all on this. We see it a little bit on this. We're going to put up a T1 weighted view. So now this is called T1. Fat is bright again. Marrow is bright, but fluid is dark. In the spinal canal here, really dark. And so if there's edema or granulation tissue that might have been bright on the T2 weighted image here, now it's dark. So now we can see there's darkness. It stands out a lot better. Now we can see clearly that there are some definite erosions of the bone here, just obviously. And here you can see how they're just invisible, because the brightness from the fluid and brightness from the fat go together, and it just makes it look like the rest of the bone. Here the brightness from the fat is here, but it's not here, so it really stands out. So in the end, we're left with an enthesopathy or a spondyloarthropathy here. This may be ankylosing spondylitis, or it could be psoriatic arthritis. And I'm thinking about that because this is we don't see the other changes up high here like we would typically see. Here's actually some subtle changes right here, that little bright marrow edema. And the patient did have some asymmetric inflammation of their SI joints as well, their sacroiliac joints, and that's another place that can get enthesopathic changes related to a condition like ankylosing spondylitis or psoriatic arthritis. So this is one of those two, an enthesopathy, and this is a cause of their back pain. Luckily there's no disc herniation that would need surgery. And that's it. Thank you so much.